All right. So it's 11:30. I'm going to go ahead and get started. If anyone else pops in, then they can always view this from our archive. Today we're going to be talking about the new coalition workbook that we developed here in the prevention department at Preferred Family Healthcare. It's just going to be a brief overview of what the workbook looks like. We're going to talk about some of the things that it has in it, how it will benefit you. First thing I want to do is just tell you a little about myself. I am a certified prevention specialist for Service Area 14 here at Preferred Family Healthcare. I service 9 counties, which include Adair, Lewis, Knox, Scotland, Schuyler, Marion, Shelby, Clark, and Macon. My primary responsibility is to mentor community coalitions through the strategic prevention framework. Before I started doing this, I worked in substance use and mental health, helping clients to recover from those. Some of the objectives that we're looking to learn today is we want to understand why we created this workbook. I want to introduce you to the workbook, and I want to tell you a little bit about how it can help you in your work. We will have a little bit of time at the end for some Q&A. If any of you guys should happen to have any questions, if you could just save those for the end, that would be great. So why did we create this workbook? Well, as a prevention resource center, our primary focus is helping coalitions to understand the strategic prevention framework. The strategic prevention framework is a mouthful. A lot of people find it a little daunting. We wanted to try and create a step-by-step book with lessons that could help people understand it in the most effective way possible. This book does that. It gives you the alternative to just go through it real slow and understand it, and then gives you a document in your hand that you can refer to whenever you're looking at applications and things like that you might need information for. So with all that in mind, we sat down and dug into a lot of different other sources such as CADCA, the KU Toolbox, SAMHSA, the SAPST workbook, and things like that. And we just dug as much information out as we could, and then we simplified it to create this workbook for our coalitions and our communities. So a little brief overview of the strategic prevention framework. It's comprised of 7 parts, the 5 primary parts being assessment, which is a profile of your population, the needs, what you have, what you don't have, whether your community is ready to change, anything like that. And it's just to make sure you have everything, what you don't need, and things like that. Capacity, who do you have helping you? Who could you have? How could you increase your numbers to address the needs that you find in your assessments? The planning is to take all the information that you've gained, look at all your capacity, and figure out what you're going to do. How are you going to implement your plans? How are you going to do things? Who's going to do what? And stuff like that. Implementation is actually taking your plans and putting them into effect. So doing your activities, implementing your curriculums, meeting with the people you want to meet with, whatever it is you come up with. Evaluation is looking at all the things that you did, looking at the assessment that you did. How did that go? Looking at your capacity, looking at your activities and events, your curriculum. How is everything working? What did we do wrong? What could we do better? And then, of course, the 2 other pieces that are not laid out as clearly is the sustainability and cultural competence. Those work throughout every step. We want to look at how can we sustain whatever it is we're doing. If we have these resources, how can we sustain those? In case one resource falls off, how can we come in and fill that? Cultural competence is also just working with all the different cultures, working with the different populations that you have in your area, and trying to tailor whatever it is you're doing to meet all of those different pieces, and doing that throughout the entire process. And again, that's a mouthful. It just can be kind of overwhelming, and we want to try and make it more simple. Whenever you say a strategic prevention framework, it can just be very intimidating, and it's really nothing that people aren't doing in their everyday lives already. They just aren't doing it intentionally. So what is the Coalition Workbook? It's a step-by-step guide for strategic planning. The workbook is broken into several volumes that will help a coalition address their assess their resources, collect data, define community, create a problem statement, and a lot more. This book will give you a great foundation and help you and your coalition and your community in the future. Currently, we have only one volume, and we're working on volume 2. We don't know exactly how many volumes we'll get into, but they're not large volumes. We don't want people to think we had so much stuff that we created these gigantic books. They're just broken into different volumes so that you can start using the information quickly and not have to wait till you get clear to the end. Though once you do make it to the end of our books, you will have a wealth of information that you never realized you had. So the workbook is broken into small lessons to help coalition members follow the step-by-step process of strategic planning. They're short lessons. The first workbook itself only has 6 lessons in it, but they're great lessons, and they have a ton of information. And we start at the beginning of the strategic prevention framework with this. We don't really say the word strategic prevention framework throughout the workbooks because it's strategic planning. No matter how you look at it, that's what it is. But you're going to be working through that SPIF process the entire time. The first lesson is really talking about, who are we? What do we believe in? Where do we come from? Things like that. It's very simple information. The first lesson probably has the largest section of the entire book because it does want to talk about the community itself. Who's the community? Where do they come from? What's important to them? And things like that. So it really is the biggest chunk, and after that, the step lessons are a lot smaller. Some of the formatting that we did, we started out with the workbook as a hard copy that we were going to work with slowly, but after we started implementing it, we had a lot of people requesting for digital versions of the book, so we created both a hard copy and a digital copy so that we can work together with coalitions in a number of ways. For the most part, we send these digital lessons to the coalitions ahead of time, and then when we attend the meeting, then we go over it in a little more in depth so that we can really hit every point and make you understand what is important. And we also like to get those digital copies back so that we can create the workbook along with you, and at the end be able to just compile all that information and send it to you all at once. The digital version is very easy to use. We've created it with a fillable format, so you can see an example here. What is the coalition's geographical area? You can just click and type directly into that. You don't have to print it off and then write it and scan it and send it back. You can just type right in there, click Save As, and then send it back to us in an email, and we can tweak it and fix it and work on it with you that way. I've taken the liberty to do a small sample of our workbook here. I wanted to show you, just to give you an idea of what the workbook looks like as you do it. All right, so this is Lesson 1, Understanding and Describing the Community. As you see here, we have a brief overview of the lesson, what it's about, the benefits of having clear understanding how we can improve local conditions. It talks about what we're going to do, what is the meaning of the community in this context, what do we traditionally think of a community, some of the places experienced, things like that. So going right in, and the first question it asks is, what is the definition of what is the coalition's geographic area? So what does the coalition define as their area? Some coalitions define just a community, some define a county, some are even larger than that. So I just went ahead and filled this in, and the coalition's area is the county of Hooverian. That's the county we're working with right now. As we go on, we talk about a community description, and it just gives you a real step-by-step. So what is the length of time the coalition has been in existence? This coalition has been around for 5 years. And then it asks for like a general history of the coalition. How did it get started? Where do we come from? The coalition was formed in 2093 when a group of concerned community members came together to protect the youth in their county from using substances. Some of the key people in the community, we went ahead and listed them. Jim Jimerson, the mayor. Andy Anderson, councilman. The Rock, he's an actor. Scooby-Doo, he's a detective in the community. This here is just, we want to know your demographics. When writing for some grants, it's important to know the demographics you're working with. And in order to work in that cultural competence, it also helps to know what you're working with. So we put in some numbers. These are kind of some more typical numbers. 91% Caucasian, 6% African American, some less than 1%. We have male and female, other, some of the education information. And this stuff, as we work with you, we would tell you where can you find this. Share that information with you. Something like this could be found on the U.S. Census website. So going on to the next part, does the coalition have expenditures, resources, in kind? How do we get money? How do we spend money? The coalition hosts multiple community activities throughout the year. We seek donations from local businesses as well as a local donation box. We are currently working on our 501c3 status. That's just a real brief example right there. So what are some of the issues of most concern? Youth substance use and safety are the primary issues of most concern. We believe youth are chewing tobacco and drinking in large numbers when out of school. So this coalition feels that kids that are out on summer vacation or spring break or just the weekends, are just spending a lot of time chewing tobacco and drinking, which is, more common of a rural community. Some of the key allies in the community, Bobbert Roberts, he's with the Chamber of Commerce, Jack Nicholson, the principal, Jill Jackson, the administrator of the health department. Some of the key opponents, Steve Smith owns a bar, and Nick Cook is just an angry old man in the community who likes to complain. So this is just a brief overview, knowing who you can lean on, who you can talk to help, knowing who might stand in your way so you can plan for that eventuality and be aware of it. So this is just one small part of the first lesson that we've gone over here, but it's not bulky. It doesn't take a lot of time, and it's extremely valuable information. You've got to know that geographical area if you're going to apply for a grant, so you can say, well, this is the area we serve, and then the population that we serve, we know who they are so that we can work with them and make things effective. So going back to this, so once you fill those in, you can save them and send them back to us, and we can make any changes or recommendations and keep that information saved so that at the end we can create you a fully digital version of your workbook, and then we can send that back to you and you can copy and paste things and use them as you see fit. The workbook helps create vital pieces of information that the coalition needs to be successful. One major part of a coalition is their vision and mission statements. A lot of coalitions know what they want to do, they know why they exist, but maybe they haven't taken the time to sit down and write out, this is our mission, this is what we're here to do. They're more concrete and are definitely more action orientated than vision statements. So your vision statement should inspire people to your dream, to your mission. You want to get that one-liner out there that just makes people say, I want to be a part of that. I want to help out. So some people are also not very familiar with data sets and stuff like that, where to get it, how to read it. We use a couple different types of data, and this is another part that can be real intimidating to people. But we want to introduce people to it. We want them to get comfortable using it and understand how it can be helpful. The workbook talks about quantitative data, which is a big word, qualitative, but it just means, you know, stories or in-person interviews or numbers that you get on a website or from surveys, things like that. And it's information you have to have, because we can say we know what the problem is because we see it on the news or because we hear about it from our neighbors and stuff, but unless you have real data that you can prove there is a problem. Something like the Missouri Student Survey, that's right directly from the mouths of the students themselves. They're the ones answering those questions and saying, yeah, I'm using tobacco, you know, once a week, or I've tried tobacco when I was 12. You know, they're the ones telling you the facts, and so you can be aware of that. The workbook helps focus coalitions on some problems rather than trying to spread their resources across everything. We can't save everybody all at the same time. We have to work on the big problems and get those down and then move on from there. So we talk about rating the substances of most concern using our data, not just guesses or the news, things like that. We want to talk about, well, the surveys show that alcohol is a huge problem. We need to focus our resources towards that first and work on that, because we can make the best impact there. We also include some additional documents that a lot of coalitions aren't familiar with. One of them being a Coalition Involvement Agreement, or a CIA. This is just an informal document that you can give to coalition members, stakeholders, some of those leaders in the community that say they want to help. This is a great way to get them involved. You put in their sector, their name, who they work for, and then say, you know, I agree to attend coalition meetings, or I agree to donate financially, or I agree to give space, you know, something that you can bring back and say, hey, we're having an event, we brought your CIA, said you would agree to allow us to use the community center for this, or you said you would donate to allow us to put this on, and we just wanted to let you know it's time to fulfill that commitment. It's not a legal document, it's just something to help hold people accountable. And we include that in an appendix in the workbook. And in the digital version, it's fillable. You can just type all this in and then print it out and get some signatures, and you have it. So one of the big parts of the workbook is the problem. We are going to help you create a little flow chart on what the problem is. So that this is in the last section of our first volume. When you reach this, you should have everything you know to answer the question, what is our problem? You're going to have the data, you're going to have the community description, everything you need. And you'll be able to look and say, well, this is obvious. This is the problem, and this is a problem, and this is a problem. We know this because we have data, we've looked at it, we've researched it, and it's a fact. So why bother with all this? Why take this workbook? You guys are busy, you know, you have other things that you're doing, and why should you bother dealing with this? Well, one of the biggest reasons that we created this is we want our coalitions to be able to get the funds they need to make their communities successful. Our hope is that you can take these workbooks at the end and literally copy and paste the information necessary to apply for some bigger grants, to apply for mini grants, or maybe even someday to apply for a DFC grant. Because we've looked at the grants, we've looked at what they require for the applications, and we've taken those pieces and put them in our workbook. And we put them in step by step so that you can create these grant applications so easily when you're done. And that's why we're here. We want you to be successful. And that's why we took the time to create these books. And they're still a work in progress. They're not a perfect document yet. But with your help, they will be perfect. And we can find any flaws in them, fix them, and make everyone successful. So that's all I have on our brand new Coalition Workbook. At this time, I'd just like to give everybody a few minutes if you have some questions that maybe I haven't answered that I could go over right now. Feel free to just type your questions right there in the chat box, and I'll answer them. So we have, as a PRC here at Preferred Family, we represent a 27 county area in northern Missouri. And I believe we have, I think, 12 or 13 coalitions throughout those 27 counties. But there are coalitions throughout the entire state. They're all over the place. Not every county has one, but it's kind of the dream that every county does have one. If you're interested in learning more about coalitions or how they are formed, or if there is one in your area, I would definitely love to hear from you. I did put my contact information here on slide 2. If you want to give me a call or send me an email, I would definitely love to give you that information, see if we can get you connected with a coalition, or if you're in a different service area, we could also get you connected with a different PRC. Corey asked who should be working on the coalition workbook. As a prevention specialist, we primarily work with the leaders in the coalition, but it can be the entire coalition working together if that's what you would like. The leaders are the ones usually involved in the assessing and the planning phases, but it just depends on how involved everyone wants to be in the process. All right, do we have any more questions? Looks like maybe not. Well, I want to thank everybody for their time today, for attending this. Please be sure to take my information if you have more questions. I would love to get together and answer those for you. Thanks again for attending, and be on the lookout for our next webinar. We'll send out another email letting everybody know what it's going to be and when we're going to have it. Hope to see you there.